then you exhale, and it gets small. Inhale, lung gets big. Exhale, gets small. Okay. Now, the coronavirus comes in, starts destroying our cells. Our cell walls start to become leaky. Hi, my name is Dr. Duc Vuong. I'm a world-famous bariatric surgeon, author of 13 books with more on the way. In the background, you'll see my med school diploma. I graduated from Texas A&M College of Medicine as a doctor of medicine, so I'm actually an MD. And here is my diploma from surgery residency. I finished that at Christus St. Joseph's Hospital in general surgery, and I graduated in 2005. I've been doing a Facebook Live a day, and today video I want to explain to you how the coronavirus really kills, and I want to do it in a very simple to understand way. So the coronavirus has to get into our face, okay, into our respiratory system. That is our nasal passages or our oral airway, okay, and it goes into and down your trachea. Okay, our trachea is our windpipe. Another term is the windpipe. There's two pipes back here in our little scrawny chicken necks. One is our esophagus. That's where our pie goes. I'm from Texas, and so this is our pie hole. And so pie goes down our pie hole and then down our esophagus into our stomach. And when you burp, people don't know this, but when you burp, it goes from your stomach and out your esophagus, and you burp. But the second pipe, and that's actually in front. The esophagus is behind the trachea. The trachea is in the front. That's the windpipe. That's if you've ever swallowed anything wrong and you start coughing, right? So when you cough, it comes from our windpipe and down into our lungs. The reason why we're able to speak is because air moves out of our lungs and goes between our vocal cords, and it vibrates, and that's how we phonate, make sound. Okay, so two tubes. The one we're concerned about in this case is the windpipe. Our oral pharynx, our mouth, nose. So a lot of people don't realize this is all connected, and you fuckers know what I'm talking about, right? Have you ever done that and you accidentally swallowed a booger? You know what I'm talking about. Right? Come on, you know what I'm talking about. Well, the reason how you could swallow a booger is because there are passages, our sinus passages, and it comes down and connects back into the back of our throats. Right? And then that's how the booger gets from there down to our throat, right? It's just, I know it's gross, but that's what it is. So that's what happens when you get nasal sinus drips, etc., and you have things like that, when you post-nasal drip, as they call it, right? And you hawk up a loogie, because it's all connected. Anyway, so this virus is going to make its way into our respiratory tract and down our windpipe. Okay, now when it goes down the windpipe, you've seen the pictures, it goes into our lungs. So I'm going to demonstrate this with these two sponges here. Okay, let's say these are our lungs, and our lungs are right here. And just a quick anatomy lesson, just real quick, our lungs actually come up to the top of your clavicle. The very top apex goes up here, and it goes way down here. It goes all the way back, and if you're skinny enough, you can feel where your rib, here, let me feel my lowest rib is way down here. I hope y'all can see that. Okay, so this is all lung, and your ribs are intended to protect your lungs. That's basically the primary purpose of your rib cage. You're to protect your vital organs right through here. Okay, so now you pretend like these are lungs. Your lungs are much larger than these, but you get the idea. Now these sponges also, if you look at them, I'm going to zoom up here, have these open sacs in here. Okay. Now in our lungs, these sacs are what we call the alveoli. That's plural. Alveolus is the singular if you're talking about one sac. Now that sac is where the air goes in and gets exchanged. Oxygen comes in, carbon dioxide goes out. Okay. Now there are two types of lung cells. Type 1 pneumocytes is where the oxygen exchange happens. That's type 1. Type 2 is responsible for producing what's called surfactant. Surfactant is a gel-like gooey substance that it lines our alveolus, and it helps the alveolus to open and close, open and close. It's like a lube. Okay? I just had a sexual thought. It's not very professional of me. That's not very professional, Dr. Vuong. Okay, so I could share this if you were more professional. All right, so our alveolus, so two types of cells. Now, the coronavirus, that little fucker, is going to come down here, and it's going to attach to our type 2 cells. It doesn't attack type 1, it attacks type 2 lung cells. Okay? The lung cells are called pneumocytes. Pneumo for lung and cytes for cells. Okay? So type 2, the one that makes the surfactant. And then all the purpose of the virus is to duplicate itself. So it makes a bunch of little progeny, and then it escapes that cell and kills that cell. Now when that cell dies, it creates a huge inflammatory response, right? And that inflammatory response causes release of things like interleukin 1, interleukin 6, tumor necrosis factor, a bunch of different cytokine responses, whatever. And it alerts these cells like neutrophils that will come in there and gobble things up and try and look for things to kill, and etc. And sometimes it's the over response. Now this is going to become important here when I talk about how this kills you. So when that alveolus, when that one cell, that type 2 cell dies, it causes these inflammatory response. These inflammatory markers make the cell membrane, the cell lining, like leaky. So fluid starts to go into your alveolus. It starts to fill these little pockets, okay? Not only that, but that inflammatory response will actually start to fill what's called the interstitial space. That's the space between the alveolus. It's the actual lung tissue itself will fill up. That's the interstitial space will fill up with fluid. So what does this look like? Okay, so here's the expanded lung. Everyone take a deep breath with me. Your lungs are really expanded way down low. All right, taking a deep breath. The muscle most responsible for taking a deep breath. Anyone know? Anyone know what's the muscle most responsible for helping you take a deep breath? It's actually your diaphragm. Your diaphragm is, and singers know that. And so take a deep breath, and then you exhale, and it gets small. Inhale. Lung gets big, exhale, gets small, okay? Now, the coronavirus comes in, starts destroying our cells walls start to become leaky, and fluid starts to come in. So what I have here in front of me is this bowl of water, okay? Now, what's going to happen if fluid comes into your lung space? Initially, it won't be so bad. Look. See, it's still working. Okay. But as this inflammatory response gets bigger and bigger, watch this now. More and more fluid gets in here. More and more fluid gets in here as the days pass and people start to get sicker and sicker. Now you try to take a deep breath, right? Now your lung is full of fluid. Okay? Normal lung. Okay? Lung full of fluid. Try to take a deep breath. Can't breathe. Can't breathe, Dr. Vuong. Okay? Imagine that. That's what's happening. Now, when this happens, you will go into something called ARDS, acute respiratory distress syndrome. Oh, I shouldn't. Oh, my girlfriend's going to get mad at me. Shouldn't have used the white towels, huh? The things I do for you guys. Okay. Science, baby, science. I thought this was going to be so much better than yesterday. Like I thought I was making a mess yesterday, and I thought this time I'm going to be smart about it. This is awful, awful. Okay. My hands are all red. Damn it, man. Get on with the demonstration. I'm impatient, don't you know? My time is valuable. I know you spent 13 years going to school to learn this shit, but goddamn it, get to it already. Hurry up. Haters, what are you going to do, man? You know what you going to do. Okay, my hands are red. Look at that, pink. All right. So now, when you have fluid inside your alveoli, usually it pools at the bottom, not always. It's also close to the bronchial passages. Okay? When it fills full of fluid, what is that? It's called pneumonia, right? Now comment if you've had pneumonia before. A lot of people have. And comment if you've had a loved one who's died because of pneumonia. And a lot of people do every single year. And that's why we encourage the pneumococcal vaccine, which, by the way, will not protect you from this coronavirus. So when you have a little patch of pneumonia, you can still breathe. But now if you imagine your lung is full of liquid, can't breathe. Comment if you've ever had asthma attack so bad you felt like you couldn't catch a breath. Comment if you've had pneumonia where you're like, I can't take a deep breath, man. Can't take a deep breath. Well, that's what it feels like, okay? So people are confused because they say, I don't get it, Dr. Vuong. This is just like the flu. No, it's not like the flu. Yes, most people will recover. Now remember, when the CDC says like a mild case of coronavirus, they don't mean a mild case of the flu, guys. This is worth sharing right here. When we say you're going to have a mild case of coronavirus, the definition is you're not going to be hospitalized. That's all that means, is you won't be hospitalized. So 80% of people won't be hospitalized. The other 20% will need hospitalization, and we cannot handle that. You are going to overwhelm the medical system. Okay? That's what you've seen happen. Now, of those who need hospitalization, a lot of them, half of them, will need ICU care because they're getting so sick, right? We don't have enough ICU beds. Of those, half of those people are going to need respirators, ventilators. We don't have enough ventilators. So, when you can't breathe because your lung is full of fluid, right? Oh, I can't breathe. I can't breathe. Your doctor is going to say this phrase that needs to scare the shit out of you. They're going to come out to the waiting room and they're going to say, Miss Jones, your mom is very sick. Your dad is very sick. He's breathing really heavily. And here's the phrase they're going to say. We are very worried that he's going to tire out. We're very worried that mom's going to tire out. Because she's working so hard, remember? Can't breathe. Can't catch a breath. My lung is full of fluid. Can't catch my breath. We're worried she's going to tire out. We have to put a breathing tube. Now you know there's 2 tubes down her throat and help her breathe. So now you know the breathing tube goes down your windpipe, your trachea, not your esophagus. Okay, and now we're going to try to breathe for you. Now, how does coronavirus kill you? It's through this pneumonia process. You don't die from the flu-like symptoms, guys. But now you have a lung full of fluid, and you can't. You get tachypnic, that means breathing fast. Oxygen is not exchanging. And then you go into something called ARDS, acute respiratory distress syndrome. And this is why you need the breathing machine. This is the treatment for ARDS, is ventilator support and supportive measures. By that we mean there is no real medicine to treat this. And that's how you die. Your body causes this massive inflammatory response that leads to a lot of fluid that goes into your lungs, and then you can't breathe. We have to put a breathing tube inside of you to rest. We're worried you're going to tire out. And then we give you a bunch of medicines that hopefully will get you through this. Now, what are we trying? The tried and true medicine for ARDS is one, the ventilator support, its settings. So this is a little technical, but we want to oxygenate you, but we don't want to give you we don't want to force too much air because we'll blow out your unaffected alveoli. So then if we don't give you enough what's called tidal volume, then you're going to build up your CO2. So in order to blow off your CO2, we have to increase the rate at which we breathe you. This is a little bit more technical. That's called a respiratory acidosis. You know, hey, I really did go to med school, okay? And to get rid of that respiratory acidosis, we have to breathe you real fast. So when your loved one is on this breathing machine, they're going to have really small volumes, relatively speaking, and a faster breathing rate, typically. And then they add something called PEEP, positive end expiratory pressure. It's a little bit extra plus when you exhale, an extra dose of air to try to pop open your alveoli. Okay, so the main treatment for ARDS is ventilator support. 2, a medicine called methylprednisolone, which is an IV steroid. So don't call your doctor's office. Don't say, I need to be steroids. This is not, yes, it's the same class of steroids as like what you might have taken for an asthma attack or a lung infection or something like that. Or you've been stung by bees, or you have welts or stuff like that. It's an IV steroid called methylprednisolone, and it's very powerful for decreasing inflammation. Now, some of the other stuff that they're talking about that you guys are all up in arms about, it's just too early to tell. The chloroquine is an anti-malarial drug. It stops, protein synthesis. The azithromycin, suddenly everybody has their Google degree, MD degree. It's an antibiotic, okay, which is for bacteria. This is a virus, but it works on protein synthesis also. If you ever had a Z-Pack, that's the Z, azithromycin of a Z-Pack. And then they're also trying other antiretrovirals, which are, HIV. We have forgotten about the AIDS epidemic, sadly. And HIV is a virus, so they're using HIV medicines to see how it works. Yes, some of these are promising, but the data is really too soon to tell. The treatment is going to be supportive measures. Guys, IV fluids, respirator, rest your lungs. Now, what happens when you get put on this respirator? This is weeks. Weeks. Listen to me. Weeks. If you went through the swine flu, the H1N1, if you went through the first SARS back in 2002, if you've ever had terrible pneumonia, you are on the ventilator for 2, 3, 4 weeks, a long time. So the average days seem to be about 2 weeks for this coronavirus. So it's not fast, y'all. Now, 2 weeks means you're going to be visiting your mom in the ICU. You won't even be able to visit because they won't have room. They don't want you to catch it. You'll be on lockdown. So basically, you'll be at home worrying about your mom, who could die at any moment. And the worst thing for a child is to not to be there when their parent dies. And I know because that's what happened to me when my dad died at home hospice. He was at home. He had metastatic colon cancer, and I was on my way to see him. I visited him every day. I drove an hour to see him. And I was 10 minutes away when I got the call that he had passed. So this is the reality if we don't catch this coronavirus, if we don't start taking this coronavirus thing a lot more seriously. Okay, guys? There isn't a treatment. A vaccine will not be available for 12 to 18 months. It has to go through clinical trials. That's awesome that they have identified what's called candidates for a vaccine, but they still have to do the different phase trials to get through. Okay, I promised you I would take some questions. I hope this has been helpful so far. I hope this demonstration makes it easier for you to understand.